Margaret, I'm going to start with you.
Okay.
Can you tell me about your reaction to the events of July 26th?
Yeah, you know, when I first heard about it and saw some of the tapes, I was absolutely appalled. It was totally an unexpected event. Nothing that I ever would have thought would have happened to one of our nurses here at the university. We immediately responded, working with Alex, making sure she was okay. That was my first priority. And then also meeting with other key leaders in the organization and the police department to start the process of figuring out how we're going to make this never happen again. So we put some new things in place, and we've been working ever since to try to make sure that that our policy is clear, simple, and we don't ever have any of these interactions again.
Will you explain this new protocol?
Sure. In the past, the nurses have been, the patient care nurses have been taking care of their patients, and the police officer comes up and they interact together with whatever the police officer needs. And what we've done is we've said that that will no longer happen, that the nurses really have to take care of their patients and they should not be involved in any more interventions with the police. The police will come into the hospital and they will ask for the house supervisor, and then the house supervisor and a police officer that's going to be working here in the hospital will meet with the police officer who's come in, and they will find out what the needs are and work through any issues that they might have outside of the patient care area, then go up to the floor and interact with the patient with the house supervisor present.
And what does that accomplish?
So it takes the staff nurses out of the equation. It makes sure that the staff nurses are there just taking care of their patients and they're not doing these other things. It also makes sure that somebody who's highly trained and has all the information that they need to take care of the police officers' need are all the ones that are interacting with them, and not nurses who may or may not have had all the information that they need.
And what has been done to support Alex?
So, you know, Alex is a strong person, and but she's gone through kind of a traumatic event. So what we've done is just support her with whatever it is she needs. When she took some time off, she comes back to work. When she's worked, she's fully here, fully engaged. And we've just been trying to support her in many ways. As she needs things, we get them for her, and we make sure that she's all right. So it's going to take some time for her to work through this, and we're here to support her in wherever she is in her path to getting back to fully normal.
And we're here with, you're sitting here with Chief Brophy today. Can you tell us what you're hearing from nurses? Are they feeling like perhaps this isn't a safe place to work?
Right.
So what are we doing?
Right. I think that's been the number one issue for nurses, is that we, as I've made rounds and talked to people, and many people have sent me messages, is that the trust has been broken. The nurses see the video and they know that the security guards didn't protect them as they thought they would, and they're curious as to why that happened, and they want to know if they were in an incident such as this, or maybe slightly different incident, what would happen to them. So we need to make sure that we have some things we need to be doing. So we've been very rapidly working through all the situations between the police department and the hospital staff to say, what is it that we need to do to make this situation better? How do we make the jobs clearer, the communication process smooth and seamless, and how do we make sure that not only are the staff feeling safe, but they are safe, and that they have advocates with any kind of police officer interaction.
So Chief Brophy, I want to ask you, when you hear this, that some of the trust has been broken, can you address that?
Yeah, that breaks my heart. I get into this business to protect and serve, and without the community trust, we don't have a job. And we have thousands of interactions here at the hospital on a yearly basis, and 95% of them, 99% of them go really well. This was one that went really wrong and eroded all of that trust that we've been trying to build up. It's now our job to step up and to rebuild that trust and do what we need to do to make sure that everyone that works, lives, and visits here feels safe, and that they actually are safe, and that they get our assistance when they ask for it.
Do you feel like your officers that day let Alex down?
Yes, I think that we could have stepped up and been a champion and an advocate for Alex at that time. Having seen the video and firsthand what she went through and what she tried to do to de-escalate and solve the problem, I think that somebody else, security and/or police, could have stepped up and taken that role from her and been the advocate for her like they should have been.
So moving forward, what is your department going to do to fix this situation?
So as we've discussed earlier, since the day after this incident, the new protocol that's gone into place I think will help solve a lot of the problems. Our department in general will be doing additional training. We've debriefed this incident already, and we will continue to talk about this incident to make sure that it never happens again.
And the two of you are here together. Are you committed as a team here at the university to work on this moving forward? Do you feel like there's trust between departments now to move forward?
I absolutely do. I think that we've had a great relationship, and I think we're going to continue to build on that relationship and hopefully learn from this setback and make us stronger in the future.
And what are you doing in terms of offering training for your officers to make sure that they will step in and de-escalate moving forward?
Well, first I'm going to make sure they understand they have my support, that if they have to step in a difficult situation like this, that they have the support of their police chief to make sure that they know that they're going to be backed in this type of a situation. And then de-escalation training and being an advocate is always ongoing for our department. And anytime we debrief, we learn from prior incidents, and we'll definitely learn from this one.